Okay, since I couldn't round anyone up, I'm just going to have to demonstrate on myself. And since it's kind of bright. Since I, believe it or not, can't find a flashlight in my house right now, and I don't have any thickener to make thicken liquids, I'm just going to have to kind of tell you what I would do if I did have those things, and that's how I'll demonstrate that portion of the test for you. So I would start with, normally I'd have everything set out, my thin liquids, puree consistency, chop consistency. I don't have a mashed consistency because I don't have mashed potatoes or anything like that right now. And I'm going to use a pretzel for a solid food consistency. And so I would just start by introducing myself to the patient, and by now I would have already introduced myself. We would have gone through some of the initial steps, the oral integrity exam, and the airway function exam. So I would let them know that we were going to do a little swallow test and show them what they'd be drinking and eating during the test, and explain to them why I'm doing this test and what they'll be doing during the test, and then run through it as I'm going to do for you now. So, say, okay, Mr. Bernardini, I'd like you to take the cup in front of you and take a sip of the water and hold it in your mouth briefly, and I'm going to place my fingers on your neck and feel to make sure everything feels okay when you swallow. So go ahead and take a sip of water, and okay, you can swallow. Alrighty, and everything felt okay, and I'm just going to ask you to count to 3 now. 1, 2, 3. Okay, I didn't notice any gurgliness or anything funny in your voice when you were counting, so I'm going to ask you to just do that one more time for me, though. Okay, and now if I had thickener, I might move on and test thickened liquids if I felt that they needed to be tested for thickened liquids, but since I don't, I'm going to move on to puree consistency. And so I would say, alright, Mr. Bernardini, now I'm going to ask you to take a bite of the yogurt in front of you and swallow it. And I'm going to do the same thing. I'm going to place my fingers, and I'm going to just make sure everything feels okay when you swallow. Okay, take a bite. Okay, and go ahead and swallow. Alright, and as the patient was swallowing, I would examine, make sure nothing came out of their lips. I'd examine and make sure everything looked okay in their face, and afterwards I'd ask them to open their mouth. If I had a flashlight, I would look inside, ask them to lift up their tongue, open their mouth wide. I might tell them that I'm going to let them know I'm going to briefly place my fingers in their mouth and pull their cheeks to the side. Maybe pull their lips apart, open their jaw and look in their mouth and make sure there was no puree consistency food still left in their mouth on any of their oral structures. Then I'd ask them to move on to the chopped consistency. Okay, Mr. Bernardini, now I have a bowl of chopped bananas, and I'd like you to take a bite of one of the bananas for me, chew it up and swallow. Okay, And I would do the same thing I did with the puree. Just observe them as they were chewing. Watch to make sure everything looked okay. And then look inside their mouth with the flashlight if I had one. And make sure there was no remaining food on any of their oral structures. And okay, now I'd like you to try to eat this pretzel for me. So I'd move on to the solid food consistency. I'd say, Mr. Bernardini, could you please take the pretzel and put it in your mouth and chew it up for me and swallow it. Okay, and now can you count to 3 for me? 1, 2, 3, okay. Everything sounds okay with my voice, and I didn't notice any choking or any coughing, and so I'm just gonna use a flashlight and take a look inside your mouth. Okay, and you can't see it, but I actually can feel I do have some food lining my cheeks and some food on my tongue, so I might want to retest them or possibly try a different solid consistency. If I had crackers, I might try that now and take a look in their mouth and make sure everything was okay. But overall, I didn't notice any difficulty with my swallowing. I didn't have to cough, I didn't choke, I didn't have a gurgly voice. Everything looked okay with my oral mechanism as I was chewing, and there was a little, like I said, a little bit of food left on my cheeks, but nothing to warrant anything to worry about, so I would pass the test and I think I'd be cleared for an oral and liquid diet.